Hi, I'm Physio Phebe, and my topic for today is probably the most dreaded knee injury of them all, the ACL. I'll explain what happens and how to manage it. The ACL refers to the Anterior Cruciate Ligament, so it's one of the ligaments deep in your knee joint that's main role is to prevent anterior translation of the tibia on the femur. So basically the bottom of your leg sliding too far forward. And it also helps control these twisting movements. So it gets damaged during an action that forces it beyond its capacity, and this usually happens in three specific ways. So firstly, it can be caused from no contact, which is the most common, and it's simply when you're changing direction and it's often like a cutting action. Secondly, it can come from some contact from either someone else or something else, and it's often from the outside of your knee. Or thirdly, it can be indirect contact, so when you're up in the air and you cop a knock and then it forces you to land differently than you had planned. You may hear a pop or a crack sound, and you often get pain immediately and are unable to continue your sport or activity. Then usually in the first 2 hours it swells up quite a lot and it can feel unstable when you're walking. A physio can perform a few tests that indicate the high likeliness of an ACL tear, but an MRI will confirm the diagnosis. And importantly, when you do your ACL, you can often actually injure the medial collateral ligament or the medial meniscus as well, or there may be some bone bruising as well. So that reinforces the importance of getting an MRI to make sure the diagnosis is correct, to therefore guide the management. You can choose either a surgical or conservative approach, and this should be discussed with your physiotherapist and orthopedic specialist, as ultimately the decision will depend on individual factors such as age, the sport, and lifestyle factors. If you have opted for surgery, which is a common choice, it's recommended that you do at least 5 weeks of pre-op strengthening under the guidance of a physio. This is highly recommended as it has been shown to result in better outcomes post-op than if you have done nothing beforehand. Post-op physio should start as soon as possible after surgery, with the initial goals to get your knee bending and straightening, to get the muscles firing and reduce any swelling. The physio will then guide you through the rehabilitation process, and towards the later stages, they can work in conjunction with a strength and conditioning coach or an exercise physiologist to really tailor your program to the specific activity or sport that you want to get back to. Longer term, there are specific ACL prevention programs available that decrease the risk or reoccurrence of an ACL injury. And there are common ones such as the netball knee program, which are readily available. I'll put a link underneath the video. And these are recommended to be incorporated into trainings and on game day in the warm-up. To help manage any swelling, I like these LP support ice bags that come with a wrap, so you can wrap it around your knee and it leaves your hands free to do other things. And then compression sleeves or compression tights can also help with swelling and just general pain relief or comfort. And then on return to activity, it's not often recommended that you wear a knee brace, so if this is something you're interested in, it is definitely worth discussing it with your physio first. And then you can also check out my product selection guide with LP support, which will give you my suggestions for ACL injuries, so I'll put the link below the video. In regard to returning to sport after surgery, the current evidence is suggesting around 9 months for an elite athlete, around 12 months for a non-elite person, and then closer to 18 months to 2 years for someone under 18. However, in saying that, the rehab protocols are now moving more towards criteria-based rather than simply time-based. So this means that your rehab program should be more driven by reaching certain milestones before you move on to the next phase. So for example, before you start running, you should be able to single leg press 1.5 times your body weight and be able to balance on that single leg with your eyes open for 45 seconds and then with your eyes closed for at least 10 seconds. So as you can see, although they're common, ACL injuries still really require an individualised physio approach. So to find a physio in your area of Australia or New Zealand, you can search on the Find a Physio section on my website. And remember to follow me, Physio Phebe, on Instagram or Facebook, or sign up to my mailing list on my website for more regular free physio tips.